that health workers are not equipped to fight the disease. We're joined now by President Dr Kgosi Letlape. Very good evening to you, Dr Letlape. Thank you so much for speaking to us. So you've looked like, or just tell us what the situation is here in South Africa. Kgosi Letlape, are you with us?
President. Yes, can you hear me?
Yes, now we can, sir.
The situation in South Africa is such that the call made by the presidency and the government is an important call. And we urge all South Africans to comply with the 21-day shutdown period, because that is the only effective way we can avoid harm. We can't treat ourselves out of this epidemic, and it is important to prevent and break the cycle of infection.
Who is the biggest threat to our healthcare workers at the moment?
The biggest threat to the health workers is a non-compliant society resulting in overwhelming the healthcare system. If you look globally anywhere else where people have not taken precautions and they have not been able to cap the spread of the disease in society, even expensive healthcare systems like you have in the US cannot withstand epidemiological failure. So people need to understand that the way out of this epidemic is to make the 21 days of the lockdown count. It is in the hands of every South African to ensure that we come out not in terrible shape post the 21 days.
Dr. Letlape, I'd just like to look at the global picture. As we speak, 510,528 confirmed cases of positive COVID-19. And I want to look at a country such as Italy, which still has, if we're counting numbers, 662 people dead. How do we differ when we look at a country like Italy, where many healthcare workers became infected? As in, how do we prevent that? I hear what you're saying in terms of us complying with the 21-day lockdown. What can they themselves do? Do we have the resources to protect them?
I think the importance and the lessons coming from Italy is that it's the lockdowns, the social distancing, the staying indoors, the improved hygiene that gets you, that prevents you from getting to where Italy went to. It's not about the availability of beds or trying to cure people and how many ICU beds we create. It's about the respect, protecting each other, social distancing, hygiene, staying in, avoiding unnecessary movements, no partying. Importantly, even in the household, improved and proper hygiene. So the key ways of avoiding what's happened in Italy is hygiene, frequent hand washing with soap and water, use of sanitizers where it is appropriate, use of masks, physical distancing. If you have symptoms of an upper respiratory tract infection, please contact the healthcare professionals. If you have travel history, self-isolate, protect those around you, those you love, your family, and the community around you. Physical distancing is critical. 2 arms length, 2 meters, no social contact. And for all our good, no going to the neighbors, no small parties, no gatherings. Contact your family using electronic media. This is time to FaceTime, Skype, Vibe, use all those media. But staying indoors, social distancing, improved hygiene is our way out of the epidemic. Let us listen to the Department of Health. Let us heed the president's call for a lockdown. Then we will come out of this with less harm. If we do not do that, we are asking for trouble. We're asking to go the Italian route. There is no healthcare system in the world that can depend on hospitalization and curing to get out of this epidemic. The solution is in the hands of each and every one of us as members of society. So we will stay in the hospitals. You must stay home. Wash your hands, proper hygiene, and we will all come out better out of this challenge.
I want to talk about personal protective equipment. We've seen that there has been a shortage worldwide, but unlike some of these things that can be manufactured, we can't say the same for healthcare workers as well. Do we have enough to help flatten the curve?
There is no one in the world, even the rich countries, that has enough of these things. And flattening the curve doesn't come from PPE. Flattening the curve comes from making lockdowns work. Flattening the curve comes from curbing community spread, because it is the community spread that will overwhelm any health system. So we should not be overemphasizing the issues of PPE. We advocate that health professionals know how to deal aseptic technique, infection control, cleaning of hands. All those things are important. When we see patients that are suspected of having COVID-19, there are protocols to follow. Isolating the patient, testing, taking a full history, contact testing, tracing, informing the National Institute of Communicable Diseases, and more importantly, the Department of Health. Remember, as healthcare professionals, COVID-19 is a notifiable illness. So do your ethical duty to ensure that any suspected cases and any cases that come back positive are reported to the health authorities.
Thank you so much for speaking to us. President of the Health Professions Council of South Africa, Dr Kgosi Letlape, speaking to us. And just a reminder, this is a special live broadcast. Countdown to the lockdown here in South Africa to try and reduce the number of positive COVID-19 cases. You may see there in that inserts pictures of the SANDF as they await an address by